Okay, welcome to my differential diagnosis presentation on Disruptive Mood Dysregulation Disorder and Oppositional Difiant Disorder. So first, both disorders have a lot of similarities. It could make it hard for a clinician to diagnose either of them, so I hope this presentation offers clarity into that. Also, keep in mind when giving any sort of diagnosis, it's something to consider is the developmental level of the individual as well as gender and culture. So here's a look at some shared symptoms. Though they are two separate diagnoses, they have a couple of shared symptoms. So in an individual with DMDD, they will have a temper outburst. This temper outburst will be dramatic, it will be explosive. The severity, the frequency, those are things to keep in mind, as well as the duration of the episode. So how that differs from ODD is an individual with ODD might have a temper outburst. It will not be as explosive and it will not last as long as the individual with DMDD. As well, there's the shared symptom of chronic negative mood. So in somebody with DMDD, they're going to be very persistently negative, especially between each temper outbursts. So this is something to keep in mind as well. So here are some other symptoms, and these symptoms here are going to really help a clinician set apart the two diagnoses. So when you think of somebody with DMDD, again, their episodes are going to be blown way out of proportion. They're going to be prolonged. And then when we look at age, so in somebody with DMDD, when diagnosing, the only criteria for age is that they have to be below 18. However, they must meet criteria A to D when trying to have this diagnosis. Individuals with ODD, they're going to argue a lot. So they're very argumentative individual. When it comes to adults, they just argue back, whether it's teacher, parent, family member. As well as they get older, they may have problems with authority and they have trouble respecting any sort of rules. They are actively defiant as well. This is something that, again, will really set apart the two, is this defiancy, as well as the biggest one, in my opinion, would be being vindictive and spiteful. So in an individual with ODD, they are very vindictive, very spiteful, very resentful, whereas somebody with DMDD, these symptoms are not present. As well, the age for somebody with ODD, there is criterion for both below age 5 and above age 5. So if you think of somebody below age 5, they must have symptoms that are very present. So it's going to be everyday outbursts for a period of 6 months. Whereas somebody who is above age 5, they must have an outburst at least once a week, as well as within 6-month period. So during an interview with a client, I would keep these key features in mind, as I feel like they really would help to differentiate between the two diagnoses. When talking to the client, I would have them, describe the mood between each outburst. I would ask them, what that looks like, if they're able to handle themselves like okay with an authority figure. I would ask them, do you think you seem irritable or cranky? And how often during a week do you have these emotions? If it was a student or if it was maybe a parent of somebody questioning their child, I would say, what has their teacher said? Does their teacher think that they are more defiant, or do they just think that they're more persistently irritable? Thank you for listening to my presentation of my differential diagnosis for disruptive mood dysregulation disorder and oppositional defiant disorder.